Hey, this is Chris with Benefits Ally. I'm excited to be joined by Rachel with ArmadaCare to take the 3x3x3 challenge. First question, what is ArmadaCare?
All right, so here's the leadership risk that no client is budgeting for right now. 55% of executives are considering leaving. When they walk, it costs the company up to 213% of their salary, and that's before you factor in things like stalled decisions and lost momentum. ArmadaCare built Ultimate Health to really eliminate and mitigate this type of disruption. So it's a fully insured executive medical reimbursement plan. We cover basically what the primary plans miss, things like mental health, fertility treatments, brand name RX, executive physicals, global travel support, just to name a few. Employer premiums are tax deductible. Employee reimbursements are not taxable income, and it's an ACA accepted benefit. You need 3 eligible employees to start, no complex setup, no new primary medical plan. It's just smart risk management for companies.
Perfect. Second question, how is ArmadaCare different?
Well, most executive benefits really get labeled as perks. Then they get ignored or they get cut. Our plan, it gets used. So our members engage with their ArmadaCare plan 86 times a year on average because they value the coverage and our service. So for example, in 2024, our members went to over 2,300 executive physical locations using our coverage and our navigation support. This one I'm really proud of. Our net promoter score is best in class year after year. It's an average of 70, which is extraordinarily high in the health insurance industry, which has an average of 27. And we rank among other leading brands in customer satisfaction. Last but not least, our clients stay with us on average of 7+ years. So there's just a lot of client stickiness with this program.
Perfect. Last question, who's a good fit for ArmadaCare?
Really anyone. So we're built for any employer with at least 3 enrolled employees, whether that's their CFOs, their board of directors, their partners, their shareholders, you name it. Rising stars working 11-hour days and hitting burnout levels. It's truly up to the employer on how they want to define those folks as mission critical employees. And then, on the flip side for brokers, I just want to clarify and say this opens doors with HR and finance leaders that are just tired of hearing the same renewal story. So this changes the conversation and changes the dynamic.
Perfect. Thanks for joining me, Rachel, and taking the 3x3x3 challenge to share more information about ArmadaCare.